Borderline personality disorder is a disorder that consists of fluctuating emotions where a person typically feels instability in relationships and demonstrates risky sexual behaviors or suicidal attempts. 75% of diagnosed patients of this disorder are females, and it affects up to 1 to 2% of the population. 10% of those who are diagnosed with this disorder end up committing suicide and are not getting the help they need. There are two types of therapy available for this disorder. The first is cognitive behavioral therapy that helps change behaviors by explaining and connecting present behaviors with thoughts and emotions. The second is drug therapy, such as selective serotonin reuptake inhibitors like Prozac, Paxil, and atypical antipsychotics like Risperdal and Zyprexa. These work by blocking or releasing certain chemicals by the help of neurotransmitters such as serotonin and dopamine.
Hey Kayla, I've been kind of worried about you lately. I think you should go try to talk to someone. They can help you get through what you're going through.
No, I don't think anyone will understand what's going on in my head.
Hey Kayla, my name's Dr. Winnicky, but you can call me Al. Please have a seat. So have you ever had counseling before?
No.
Well, don't think of me as a counselor, think of me as a friend. I'm here to help. So let's start off with some basic questions. So how would you describe your mood?
I kind of feel like my life lacks meaning. I don't really feel important, and sometimes I tend to get angry or depressed at small things. I have a hard time making friends at school.
Okay, so you have a hard time in social settings. You may feel a lack of connection and a feeling of dread when left alone.
Yeah, I guess so.
So do you feel like your mood has caused you to make any rash decisions lately?
Well, now that you say that, yes.
Why don't you tell me what happened?
Well, this one time, I was driving down the street, and this girl asked me to give her a ride. And even though I knew it wasn't safe, I picked her up. After the ride, I looked on the seat next to me, and I saw that she had left a bag of cocaine. I was feeling really down that day, so I decided to try some.
So what you're saying is you use drugs and risky behavior to compensate for the emotional distress that you're feeling?
Yeah, that sounds about right.
Has this emotional distress ever resulted in self-harm or suicidal thoughts?
Yeah. Sometimes I cut myself because I need to punish myself. I'm a bad person. I also want to show people what I'm feeling because I can't tell them.
Why do you feel like you can't talk to anybody? How is your relationships with your loved ones?
Boyfriend, but we get in a lot of fights. Most recently, he told me he wanted to hang out with his friends instead of me on Friday night. Sometimes I feel like I'm not good enough for him, or anyone for that matter. Sometimes I feel like I don't even exist. I thought he loved me, but him doing that proves otherwise.
This is good. This is good. Let it all out.
Kayla continues to see Dr. Winnicky 3 times a week for 2 weeks. Each session, Kayla's psychiatrist teaches her how to recognize her thoughts and emotions and think of better ways to deal with them through positive behaviors.
Based on our past sessions and all that we've talked about, I feel like I have a better understanding of what you're going through. I am diagnosing you with borderline personality disorder. I understand that you may not want help right now, but the first step in treating this disorder is understanding that you have this disorder and are capable of controlling your own life. We are going to get through this together. One of the methods for treating this disorder is cognitive behavior therapy, which we have used in these last few sessions. We can continue with this to help make positive changes in your lifestyle to help extinguish the negative behaviors associated with BPD.
So, what changes can I make?
Well, there are many things I can help you with right now, but I think the best thing is for you to develop a can-do attitude in negative situations.
Is there any medication that I can take to cure this?
No, but there are medications to help you deal with the symptoms. I'm going to prescribe you Prozac that will help with depression, your mood swings, and your extreme levels of anger.
Thanks, Al.
Years later, Kayla's symptoms slowly faded. With the help of her psychiatrist, Dr. L, and other support groups, Kayla got through her depression and became less reliant on what others thought of her. Her mood swings lessened and she developed a stable relationship. Today, Kayla is an overall happy and energetic person who does not participate in risky behaviors. The first step to any mental illness is accepting that you have a problem, and once Kayla demonstrated that, she was well on her way to recovery.